Thank you so much, and thank you everyone for the privilege to be here. I am going to try to go through, I've got these slides, they're going to be available to you, so I'm going to go through the slides kind of quickly, but just know that they'll be there if you want to look through them in a little more detail, because I think we really want to stay on time with our agenda. There's so many great presentations that are coming up. I'm really looking forward to them. I do not have any disclosures related to this presentation or any financial disclosures. And the objectives of this presentation is just to give a little brief outline of HIV epidemiology across California, as well as to explain some future directions for the Ending the Epidemics initiative. So this is something that all of you know, that people with HIV are aging, and this graph illustrates that. As you'll see, the graph breaks up age groups into different age groups, 50 to 54, 55 to 59, and so forth. And then in light blue are the number of people with HIV in each age group in California in 2017, and in the dark blue is in 2022. And I won't belabor this because this is something that all of you are aware of, but in the last 5 or 6 years, there's been a substantial increase in the number of people with HIV who are 60 to 64, 65 to 74, and 75 plus. As mentioned previously, current projections would indicate that by 2030, 25% of people with HIV in California will be 65 plus. And so I want to turn a little bit to talk about mortality data, cause of death data. And I think this can be really important to highlight trends that we're seeing, trends that are becoming really pressing and most important. So these are causes of death among people with HIV in California, comparing 2 different time frames. Over on the right is pre-COVID, so this 2018, 2019, and then to the right of that is during COVID, 2020, 2021. And I'll just point 3 aspects of this data out to you. One, of course, there was the emergence of COVID. As all of you experienced and know, quite a number of people with HIV passed from COVID, estimated 241 people. In this time frame, there also has been a very striking increase in the number of people who have died from drug overdose. So if you look, there has been actually a 60% increase in the number of people with HIV who have died from drug overdose, from 225 to 360. And then I think also extremely important is there have been increases, trends upward in a number of chronic cardiac and cancer-related conditions. So as you can see, there's been an increase in deaths related to ischemic heart disease, deaths related to hypertensive heart disease, as well as deaths related to colon and rectum cancers. So with that in mind, turning to treatment, there obviously are many more chronic medical conditions that people currently are experiencing and will experience at a higher rate as they continue to age. The ADAP is an acronym for the AIDS Drug Assistance Program, and that's an access point for medication for people kind of as a last resort, as well as a method to provide premium and copay insurance and medical out-of-pocket coverage for people who meet the financial eligibility. And over the years, there are some restrictions to what's allowable within the ADAP formulary, but over the past 5 or 6 years has been an increase from about 200 medications covered to over 300 medications, and hopefully that can continue to increase. Some of the highlights from 2023 that were added were diabetes treatments. Excuse me. Okay, I figured that out. Diabetes treatments, and these include the newer GPL1 inhibitors, adding insulin for the first time to the formulary, and glucometers and test strips for people with diabetes, treatments for hypertension, as well as for the first time COPD and asthma treatment, and benign prostatic hypertrophy treatment. Sorry, you'll get this. You may have heard of this, but each year California, and this is conducted nationally, but a survey is conducted among a nationally representative group of people with HIV. And they're asked a number of questions, including questions about mental health, access to services, and stigma. And in California, this is the 2021 data, a significant number of people reported moderate to severe depression, 13%, and a significant number also reported severe anxiety, as measured by the PHQ-8 questionnaire. And then when they were asked, do you need services and do you have access to those services? Overall, 7.3% of people with HIV said they had mental health needs for services and were not able to access them. And then when you restrict that to people who reported a high degree of HIV-related stigma, that percent increased to almost 22%. Felt they needed services but were not able to access them. Project Cornerstone was mentioned and it was funded by the state. It was advocated by stakeholders to get this funding and is a really innovative project where there are these demonstration projects that are piloting different innovative ways to improve the delivery of both clinical and essential non-clinical services for people with HIV. Here are the funded clinics. As you can see, Santa Clara's was mentioned as one. And I just pulled out a few of the interventions that are being looked at that I think are particularly relevant to conversations today. One is establishing a patient peer board to help guide the clinic as to what group interventions are being offered and are being implemented. So really, persons who the services are for, driving what services are going to be offered and how those services, giving direct feedback to clinic leadership about how those services might need to be modified or changed. Care management visits that are more like the annual wellness visit, where it's not just enrolling for a particular program, but looking at everything that a person can benefit for to come up with a comprehensive, holistic plan to really make sure you're accessing what you qualify for, what you could really benefit from. And then finally, trying to open more, providing more doors that people can access these really needed mental health services. So providing drama and theater therapy that is led by a mental health counselor. So I'm just going to wrap up talking, because this is so important for today, about strategic plans, thinking about the future. And California has an integrated statewide strategic plan for addressing the syndemics of both HIV and hepatitis C and STIs. And this strategic plan is oriented around 6 determinants of health, so that the plan, the proposed interventions, the metrics that are being looked at, all are within the framework of looking at racial equity, housing first, healthcare access for all, mental health and substance use care, economic justice, and stigma. And related to that, the California Planning Group is a group of key partners, communities, and providers who engage in an active ongoing dialogue with California Department of Public Health on community needs and gaps. And this group has identified HIV and aging in particular as one of the top 3 areas to advise and engage the state with, and has identified these 5 priority areas that need to be prioritized in our response for HIV and aging within California. And that is finance, housing, mental health, nutrition, polypharmacy. This will be hearing, I'm really excited to hear a lot more about this today, as these are all so intertwined. And the CPG also will be having an in-person meeting next week in Sacramento that's open to the public. And we'll be having as well an event to acknowledge and honor Long-Term Survivors Awareness Day, and really recognize that resilience, but also strive to see what we as a total community can do to build on their decades of success and help address their current both physical and mental challenges to really help well-being and health. So that was a lot, and sorry to go through so much so quickly, but to kind of summarize, as all of you know, the number of people with HIV is increasing rapidly, and in particular in the age groups greater than 60 now is seeing the most significant increases. Deaths from drug overdoses have increased markedly, while we're also seeing cardiac disease and certain cancers increasing among people with HIV in California. A significant percent of people who experience high levels of HIV stigma, over 21%, have difficulty accessing mental health services. And finally, the California Planning Group has identified these key areas of finances, housing, mental health, nutrition, and polypharmacy as priority areas to address. So I'd like to stop there and acknowledge these people who contributed directly or indirectly to the slides I presented on their behalf for California Department of Public Health, Office of AIDS. So thank you very much.